The third, Taiwan, Dr. Huang. Dr. Huang is the director and attending physician of Department of Traditional Chinese Medicine, Changhua Christian Hospital, Taiwan. At the same time, he is the director of Chinese Medical Association of Acupuncture, Taiwan, and the director of Changhua Chinese Medical Association, Taiwan. Dr. Huang's presentation is about COVID-19 case report, COVID-19 treatment use traditional Chinese medicine.
Ladies and gentlemen, good afternoon. I am Huang, the Director of the Department of Traditional Chinese Medicine, Changhua Christian Hospital. Now, I start my presentation. The title is Traditional Chinese Medicine in the Treatment of COVID-19 in Taiwan, Case Series Report. In December 2019, the outbreak of COVID-19 in Wuhan City, Hubei Province, China, spread rapidly to the world. And January 21st, the first case appeared in Taiwan. A 50-year-old woman worked in Wuhan, came back to Taiwan. She got fever, cough, and shortness of breath. Later, she was confirmed a COVID-19 patient. January 25th, a 22-year-old woman came to department emergency of our hospital with her family. She suffered from cough, fever, sore throat, muscle soreness, and so on. Also, she had worked in Wuhan City, China. She and her family were sent to negative pressure isolation ward of our hospital rapidly. Then they were confirmed COVID-19 patient. Between January to April, our hospital treated total 11 confirmed COVID-19 patients. All of them were recovered and discharged. The latest one discharged at April 9. This was a consultation form of our hospital. It was sent from department infection at January 15th. The director of department infection, Dr. Liu, sent the consultation form. January 30th afternoon, my cell phone received a consultation message. It was sent from department infection. I saw the message and checked the consultation system. It was her, the first confirmed COVID-19 patient at our hospital. I was so surprised. Then our hospital published a paper which mentioned about a local transmitted case of SARS-CoV-2 infection in Taiwan in NEJM. It also was the first paper related to COVID-19 which was published in Taiwan. Let's see the best data of the group of patients combined with TCM therapy. All the patients confirmed by SARS-CoV-2 are T-PCR positive. Chest CT scan found the lung of 5% showed ground glass opacity. According to WHO Severity Classification of COVID-19, the severity of the patient was classified mild 1, moderate 3, and severe 2. In the conventional treatment group, the patient received therapy including oral drug therapy like Tamiflu and so on. All drugs for symptom improvement and prevent the complication after SARS-CoV-2 infection. The world also supplied O2 therapy, but the patient combined with TCM therapy used no O2 therapy during hospital period. And now, let me introduce TCM treatment. The number of visits was 3 times per week. It means that we visit the COVID-19 patient once per 2 or 3 days. The treatment was based on syndrome differentiation of every patient. Chinese medicine therapy, including decoction and powder. The treating period was from January 50 to April 28. Patients were suggested they can return to visit TCM OPD per week and take Chinese medicine continuously at least 1 month to increase the pulmonary function and prevent the pulmonary fibrosis. Chinese medicine therapy, oral decoction and 5 patients, and oral powder 2 patients, and the oral medication frequency is QID, and period from January 13 to April 28. 4 patient follow-up per week at least 1 month in TCM OPD after discharge. These Chinese herbal medicines are commonly used to treat respiratory infection disease and poor digestive function. Also, some herbal medicine have the antiviral effect and increase the immunity of human body. Every patient is individual, and we order the prescription by syndrome differentiation of every patient. And this Chinese herbal drug is for respiratory system, including Huang, Xingren, Jiegang, Changhua, Qianhu, Changhua, 紫苏叶、姜蝉、蝉对、青蒿、黄芪、麦门冬跟黄芪。And this Chinese herbal drug is for gastrointestinal system, including 厚朴、草果、白豆蔻、槟榔、苍竹、砂仁、姜半夏、广藿香、葛根、党参、白术、山药、柴胡、生姜、大枣及炙甘草。And if the patient got a severe pulmonary infiltration, and I adapt like 鱼腥草 and 葶苈子. And also the patient discharge. I want to prevent the cause of pulmonary fibrosis. I will adapt 桃仁. And also some Chinese herbal medicine is for complication like headache and stubbornness. And we use 白芷 and 川穹. Discharge criteria. According to the CECC Taiwan, if COVID-19 patient want to discharge, the discharge criteria including 2 items. First, 2 samples are needed, including sore throat and sputum in general. Secondly, 3 continuously SARS-CoV-2 nucleic acid tests needed to show negative. And all the 6 COVID-19 patients combined with TCM therapy in our hospital discharged smoothly. Now I introduce the TCM treating effect of the 6 COVID-19 patients combined with TCM care in our hospital. This is the first COVID-19 patient of our hospital, a 52-year-old woman. Her O2 saturation had been down to 93% at day 8 and continues lower to 95% for 5 days. She showed severe short of breathing and difficult breathing. Her attending physician had considered to send her to MICU for further care. After combining care with TCM, her symptoms was subsided and improved. Her O2 saturation returned to normal level. At first, the patient suffered from fever, cough, sore throat, muscle soreness, diarrhea, and so on. After TCM treatment, her fever was subsided rapidly, and all the symptoms was improved. Then 3 continuous SARS-CoV-2 nucleic acid tests were negative. She discharged smoothly uh, on February 19. The first chest CT scan of the patient is showed typical appearance in both lungs of a COVID-19 patient. There were several GGO lesions appeared in her both lungs. It means that both of her lungs got a severe infiltration, and she showed severe respiratory tract symptoms like short of breath, difficult breath, and low O2 saturation. After 2 weeks TCM treatment, the secondary chest CT scan showed that the lesion in her bone lung became small compared with the further chest CT scan. And the third CT scan at April 13th, almost 2 months later, compared with February 15th, it showed that the lesion of her bone lung almost disappeared. Also, she showed no symptoms of pulmonary fibrosis like short of breath, dry cough, and fatigue when she returned to visit TCM OPD. The secondary case is a 15-year-old man. He was an artist. The type of infection is local acquirement and impact by family. He had a smoke history, and the day in hospital is 33 day of Chinese medicine treatment in 22. The patient also showed respiratory symptoms like cough, short, sore throat, sputum, muscle soreness, fatigue, diarrhea, and so on. After TCM therapy, all the symptoms will subside and improve continuously. Maybe he had a smoker history, he still got a slight cough. The further chest CT scan showed there were 2 lesions in his both lungs. There was a big lesion in his left lower lung lobe. After combined TCM therapy, the secondary chest CT scan at February 14th compared with February 2nd, it showed the lesion in his lower lobe of left lung became small. It means that the infiltration was improved. Because of the 3 continuous negative SARS-CoV-2 nucleic acid test, he discharged on February 27th. And at March 3rd, he suffered from a traffic accident. He was sent to Department of Emergency of our hospital again. The emergent chest CT scan was performed to evaluate the injury in his chest. The image showed that the lesion was almost disappeared in lower lobe of his left lung. The third case is the 88-year-old woman. She was infected by her family. The chest X-ray show like this image. The severity classification of COVID-19 of the grandma was mild. Because of the SARS-CoV-2 nucleic acid sampling had rapidly turned positive, TCM therapy was recommended for help. She got a slight symptom of cough and sputum and frost and all at the stay of hospital. But the SARS-CoV-2 nucleic acid sampling had rapidly turned positive. She consulted TCM therapy for help. At the TCM treatment, she got 3 continuous negative SARS-CoV-2 nucleic acid tests and discharged on March 23rd. The fourth case is a 57-year-old man. He was infected by his family. The chest X-ray showed like this image. He also got a rapidly positive SARS-CoV-2 nucleic acid tested and consult TCM Therapy for help. And he got a slightly symptom like cough, sore throat, and less sputum, but the SARS-CoV-2 nucleic acid test still rapidly turned positive. He had stayed at our hospital for almost 1 month. It was too long, so he decided to consult TCM Therapy for help. After combined with TCM Therapy, he discharged on April 2nd. The chest CT scan confirmed there are several small lesions in his right lung. And the case 5 was a 29-year-old woman. She had worked in Manila, Philippines before she came back to Taiwan. The chest X-ray showed like this image. The chest CT showed there are small lesions in her both lungs. She had gotten fever, muscle soreness before she came back to Taiwan, and she had received treatment in Manila. When she came back to Taiwan, she showed symptoms of respiratory tract, like cough and fever. The test of SARS-CoV-2 nucleic acid showed positive. Then she was sent to our hospital for further care. She also showed some GI symptoms like loss of taste and smell, poor appetite, abdominal discomfort, and diarrhea. When she got the TCM therapy at first, she felt the function of taste and the smell was recovered, and the poor appetite was improved. She discharged smoothly on April 16. Case 6 was a 21-year-old man. He had studied in UK. He got a nasal obstruction and a runny nose before he came back to Taiwan. When he came back to Taiwan, the SARS-CoV-2 RT-PCR test confirmed that he was a COVID-19 patient. He was sent to our hospital for further care. Besides the symptoms of respiratory tract, he also got the loss of his taste and diarrhea. After combining TCM therapy, the function of his taste recovered rapidly, and he could eat more. His symptoms got improved continuously, but the test of SARS-CoV-2 nucleic acid rapidly turned positive several times. Finally, he got 3 continuous negative SARS-CoV-2 nucleic acid tests and discharged on April 28. The chest CT scan showed the typical lesion of COVID-19 in his both lung, especially a large lesion in his right lung. After treating the 6 COVID-19 patients, we got some experience of TCM therapy in the treatment of COVID-19. There are several advantages of TCM in the treatment of COVID-19. First, decrease the symptoms of COVID-19 related, like fever, cough, sputum, sore throat, muscle soreness, diarrhea, poor appetite, loss of taste and smell, hypoxemia, and so on. The second, stop the deterioration. 2 cases suffer from severe infiltration of both lungs didn't get rose at TCM treatment. Third, promote SARS-CoV-2 nucleic acid sampling to turn negative. 3 cases suffer from SARS-CoV-2 nucleic acid sampling and rapidly turned negative. 3 continuous nucleic acid tests were negative after combined with TCM therapy. And the fourth, short the length of hospital stay. And 5, prevent the pulmonary fibrosis. 4 patients combined with TCM therapy show no symptoms of pulmonary fibrosis like shortness of breath, dry cough, and fatigue after return TCM OPT visit. 2 patients show no pulmonary fibrosis confirmed by chest CT scan. I am glad to join the team to care COVID-19 patients in our hospital. Also, I very thank Dr. Li Yulin and Dr. Liu Zhonrong, the director of the infection department. Both of them have the open mind to accept Chinese medicine join to treat the COVID-19 patients in our hospital. We work together and did the best to treat these patients. Expect traditional Chinese medicine department of hospital. There were several traditional Chinese medicine department of hospitals also joined the treatment of COVID-19 in Taiwan, like a 3 Service General Hospital. They treat 11 cases. Veterans General Hospital Taichung, 2 cases. China Medical University Hospital Taichung, 1 case. And the Changhua Hospital, Ministry of Health and Welfare, 1 case. And the Director General Yi Chao Huang, Department of Chinese Medicine, MOHW, invited all the experts of Chinese medicine in Taiwan and had a conference of interim guidelines for the inclusion of Chinese medicine in the clinical treatment of COVID-19 conference on May 6. We hope the guideline could be included in the official guideline of clinical treatment of COVID-19 made by CECC, WOHW, MOHW, and also National Union of Chinese Medicine Docs Association also had a press conference on Chinese medicine participation in COVID-19 treatment and the new life of Chinese medicine epidemic prevention. We want to inform people that Chinese medicine can help to treat COVID-19 in Taiwan. And the National Research Institute of Chinese Medicine, MOHW, designed a novel traditional Chinese medicine formula, Taiwan Qingguan Yihao, MRICN 101, has been administered to patients with COVID-19 in Taiwan since April. And the article was accepted and published by Biomedicine and Pharmacotherapy. There are several highlights. 1. A herbal-based formula deliver positive clinical outcome on COVID-19 patients. The second, the formula inhibits SARS-CoV-2 pathogenesis in antiviral and inflammatory assays. 3. Real-world evidence offer insight to inform drug development. And the 4th, back-to-bench approach shortens the time required for finding effective therapies. And this is my presentation. I hope that all the information I presented in these slides will help people to prevent and anti-COVID-19 in the world. Thank you very much.